Hello, my name is Philomena Jones, and I'm excited to present my Quality Improvement Plan project. You're all welcome to listen to this presentation. So, my content is the presentation will have an introduction to the project topic, problem identification, PICOT, components, and all the POCT statements. So, this presentation will provide an assessment to our organization, QI tool and evidence, GAP analysis, and identify the key stakeholders of the project. So this business case and aim statement will clearly be defined in this project. Introduction. So alarm fatigue is a very significant patient safety concern in healthcare settings, like for us nurses, particularly in intensive care units, tele units, medical surgical units. So we nurses are exposed to hundreds of monitor alarms during a single shift, many of which are false, clinically insignificant, and repetitive. So continuous exposure to excessive alarms causes desensitization, delayed responses, missed critical alarms, and increased stress. Plus, it contributes to burnout. So that's why I'm talking about this. So the Joint Commission has identified alarm management as a national patient safety goal because of the ineffective alarm management can result into preventable patient harm. So therefore, implementing evidence-based alarm management strategies is very essential to improve patient safety while reducing unnecessary burdens on nurses. Problem identification. So when we talk about problem identification, we're talking about alarm fatigue. According to Michaels in 2025, alarm fatigue has emerged as a critical patient safety issue in healthcare organizations, like we nurses, what we do, particularly in units where continuous physiological monitoring is common, such as medical surgical, telemetry, and ICU units. So nurses are exposed to hundreds of monitor alarms during a single shift, many of which are false, like I said, non-actionable, or clinically insignificant. So the constant exposure can desensitize nurses to alarm sounds, causing them to become overwhelmed and less responsive to alarms, like I said, that require immediate clinical attention. So as a result, clinically important alarms may be delayed, ignored, or inadvertently missed. So increasing the risk of advanced patient events, including failure to rescue, maybe a cardiac arrest, or other preventive complication, these will help in problem solving and identification. So these issues not only compromise patient safety, that's number one, okay, but also increases nurses' cognitive workload, stress, burnout, negatively affecting job satisfaction and overall quality of care. So when we talk about problem identification as continued, according to Michaels, like I said, the primary factors contributing to alarm fatigue include default monitor settings that are not individualized to patient needs, excessive false or nuisance alarms, inconsistent alarm parameters, management, inadequate staff education on evidence-based alarm management, and the absence of standardized organization policies. So when we talk about these issues, these issues not only compromise patient safety, but also increase nurses' cognitive workload, stress, burnout, negatively affecting job satisfaction, like I said. So the current evidence and recommendation from the Joint Commission, like I emphasized, is the importance of implementing comprehensive alarm management strategies, including individualized alarm settings, routine review of alarm parameters, staff education, and standardized protocols. So many healthcare organizations continue to struggle with inconsistent implementation of these practices, resulting in persistent alarm fatigue, like I said, preventable patient safety risk. So the Quality Improvement Project seeks to address alarm fatigue among nurses by implementing evidence-based alarm management intervention. They're designed to reduce non-actionable alarms, improve timely responses to clinically significant alarms, we're enhancing satisfaction and ultimately improving patient safety outcomes. So, by standardizing alarm management practices and promoting continuous monitoring and evaluation, this project that I'm doing, aims to create a safer clinical environment while supporting high quality patient care. So, when we look at PICOT components, when we look at PIC components, we look at the statement. The statement in bedside nurses working on medical surgical units, like I do sometimes. We're going to talk about how does implementation of the evidence-based alarm management program, including education, standardized alarm parameters, and individualized daily alarm assessment help. And then the I will let us compare with current alarm management and practices. And then the C will let us know about the effect, the frequency of non-actionable alarms. So the project will address how the implementation as evidence-based alarm management program, including education, standardized alarm parameters, individualized daily alarm assessment, will affect the frequency of non-actionable alarms. So nurses response to actionable alarms and non-satisfaction compared to the current alarm management practices present in my healthcare organization. So when we talk about organization assessment, we are talking about so what I did, the selected organization healthcare I was talking about is Better Care Healthcare, which is a private hospital located in the urban community. So the system boundaries include all clinical and administrative operation within the clinic, including providers, nurses, medical assistants, front office staff, and support personnel. So services outside the hospital, such as admissions or specialties practices, are excluded in this because specialties, you go out, maybe you're going to get your your appendectomy, you have to go outside, you have to get to a specialty. So this organization is a hospital serving approximately 8,000 patients annually in a suburb community. So services include preventive care, that's number one, chronic disease management, acute care visits, immunizations, and health screenings. So it employs about 10 providers, including physicians, about 10 nurse practitioners, along with other nursing and administrative staff. So the facility uses electronic health records, telehealth technology, laboratory services, and diagnostics equipment like EKGs, machines, and point of care and testing. So when we talk about organization and assessment continued, our organization have an annual planning strategy where the outcomes and the organization vision is analyzed. So the annual planning involves the collaboration of the organization leaders and staff members. So when the staff members conduct their meeting and they provide their opinions and also performances to their supervisors, who take the opinions to the leaders during meetings. So the action plans focuses on enhancing patient satisfaction, improving chronic disease outcomes, and increasing access to care. So performance indicators including patient satisfaction scores, diabetic control measures, appointment availability, and quality of benchmark. So organization assessment continued. Staffing needs are assessed through workload analysis, productivity, and competence evaluations and annual performance reviews. So the organization provides safety training, that's number one, infection prevention protocols, that's number two, ergonic assessments, and emergency preparedness procedures to promote employee well-being. So customer needs are identified through patient surveys, community assessments, demographic analysis, and review of healthcare patterns. So the hospital and the clinic together promote strong patient relationships through shared decision making, patient education, follow-up communication, online portals, and timely access to care. So these strategies have been effective in improving provider-patient relationship in our organization. So, perform gap analysis. When we talk about perform gap analysis, we're talking about a gap analysis identifying what is missing from what should be done. So this worksheet provides the difference between the current practice in our organization to what should be done. So this worksheet provides barriers that hinder best practices from being implemented in organizations. So the organization currently lacks standardized alarm management practices that I'm talking about, resulting in excessive non-actionable alarms that contribute to alarm fatigue. So evidence supports individualized alarm settings, staff education, and routine alarm review to improve patient safety and nurse responsiveness. So when we talk about business case, implementing alarms will improve clinical and financial outcomes. Investing in alarm management, education, and standardized alarm protocols is expected to improve patient outcomes while reducing unnecessary healthcare expenditures. So implementing alarm management strategies will definitely be beneficial to the organization. So aim status. The aim status The project will be implemented within 6 months, resulting in a 30% reduction in non-actionable alarms and a 25% improvement in response to actionable alarms within 6 months. So the SMART goal we're talking about here, so let's be specific. So specific, implement alarm management education, standardized alarm parameter settings, and enhanced alarm monitoring practices on the medical surgical unit to address alarm fatigue among nurses. Then when we talk about the measurable, reduce non-actionable alarm notification by 30% or increase timely nurse responses to clinically significant alarms by 25%. And then when we talk about achievable parameters, these improvements will be accomplished through staff education, competence validation, alarm parameters optimization, routine equipment maintenance, and ongoing performance monitoring. And then when we talk about relevance or relevant, reducing alarm fatigue is very crucial for enhancing patient safety. That's number one. Minimizing missed or delayed responses to critical alarms in case of any by optimizing nursing flow, definitely, and fostering a safer care environment. So when we talk about mapping actual process, when we're talking about mapping the actual process, so the actual process here shows that the patients are connected to the physiological monitoring device, which monitors the vital signs and sound when a problem is noted. So delays happen because the nurses can be occupied with other patients, which can result to complications of death. So when we talk about mapping actual process, the nurse only attends to the alarm when they're free and only decides whether the alarm is clinically significant or not. Although the nurses provide the needed intervention, it can be delayed, resulting in complications or reduced patient outcomes. So the future process will connect patient to standardized and individualized alarm settings, which will monitor vital signs and sound in case of an emergency. So the alarm is prioritized according to severity. So this new approach will reduce delays in alarm response and the risk of patient complications. So the mapping of the future process is continued. When we talk about the alarm is prioritized according to severity. That, like I said, we nurses respond immediately to alarms as they are prioritized based on severity. So intervention is provided based on patient needs and collaboration with provider done if needed. So documentation is done in electronic health records as needed. So this approach will improve patient outcomes and also reduce alarm fatigue among we nurses. So when we talk about the key drivers diagram, the key drivers will be used to measure the outcomes. What are the outcomes of these alarms? The QI project could have 25% increase in clinically actionable alarm responses rates, and then a 30% reduction in non-actionable alarm notifications. What are the project measures for this project? So the project measures shall identify both the process and the outcome measures. An analysis of the process measures, which such as total number of alarms generated, total number of nuisance alarms, relevant alarms, and also missed alarms, will help make improvements to gain high outcomes. So project measures continued. So this process measure focuses on the number of alarms that are encountered on nursing duties on a daily basis. So outcome measures will focus on the impact of the project on addressing alarm fatigue. Outcome measures to be addressed include number one, total number of monitored patient days, number of patients on standardized and individualized patients, prioritized alarms, and also patient outcomes such as safety, quality of care, and timely response. So this project will also assess patient satisfaction during the project. So the patients should be satisfied with the outcomes of the QI project by receiving safe and quality care. Safety of the nurses is another consideration because as the project aims to address alarm fatigue among the nurses, it also helps them to consider having reduced alarm fatigue. So nurses should be satisfied as well with recommended intervention and outcomes. So the summary of the project measures. So this summary, the process measures and the outcomes, so the balancing measures of the project shall be missed clinically significant alarms, nurse workload, patient satisfaction, and time required for alarm customization. So with these measures, the project will be evaluated on whether it is very beneficial to patients, nurses, and also to the healthcare organization. So the PDSA cycle. So this PDSA cycle will be a process where the project undergoes the planning stage, do stage, study stage, and finally the act stage. So each stage is important and requires collaboration with key stakeholders to achieve the desired outcomes. So when we talk about planning, we have to educate our staff, develop standardized alarm guidelines, assign unit champions, and then collect baseline alarm data. So planning is the first stage of the project where the staff members, we are educated and adequate data needed for the project is collected. So the baseline data on alarms in the organization should be collected because lack of adequate data may fail the project. So the recommended guidelines to be implemented in alarm management are developed in this stage, the planning stage. So when we talk about the do, implementing education, like I said, customizing alarm parameters, begin daily alarm review, and collect weekly monitoring data. So after planning, the next step is to do, where education will be implemented and also daily alarm reviews done. So the parameters of the alarms are customized to meet the recommendation of the project, and weekly data is collected and documented. And then when we talk about the study, what are we doing? What are we going to do? Study the number of alarms, the nurse response times, the compliance rates, the nurse feedback, the patient safety outcomes. So evaluation of the number of alarms, how the nurses are responding, and their compliance rate to the alarm parameters provided is done in the study phase. So nurse feedback, we nurses, and also the patient safety outcomes are evaluated and compared to the baseline data collected in the planning project. So when we talk about the act, what are we talking about? Expand project hospital-wide, update organization policy, continue quarterly audits, modify education like I talked about, adjust alarm parameters, and provide additional staff coaching. So the act phase influenced by the results of the evaluation done in the study phase. If the project is successful, so the actions to be taken will expand QI in other departments of the hospital, develop policies to support alarm management, and then have quarterly audits. So, in case the project fails, the action to be taken is the action to be taken to adjust alarm parameters, modify the staff education, and provide additional staff coaching to improve compliance, like I talked about. And then in conclusion, QI project to address alarm fatigue. That's the conclusion. Individualized alarm settings, standardized protocols, nurse education, continuous monitoring, smart goals process, mapping, and key driver analysis provided. So, and then the project measures and PDSA cycles well highlighted. So, alarm fatigue remains a very significant threat to patient safety and nurse performance. So, excessive non actionable alarms contribute to delayed responses, that's number one, clinician stress, and potential advanced patient outcomes. Implementing an evidence-based quality improvement initiative that includes individualized alarm settings, standardized protocols, nurse education, and then continuous monitoring can substantially reduce the alarm burden while improving the response to clinically significant events. So, through the use of smart goals, process mapping, the driver analysis, project measures, and interactive PDSA cycles, healthcare organizations can foster safer clinical environments, improve nurse satisfaction, enhance the overall quality of patient care. So, documented project charter, we talked about the project title, addressing alarm fatigue among nurses, then the project sponsor, Morningside University, then the project manager, it's V. Philomena Jones, then project start date after IRB approval, estimated July 2026, then the project end date, June 2027. So the objective is to implement evidence-based alarm management strategies to improve patient safety while reducing the unnecessary alarm burdens. Those are my references. Thank you so much. Thank you so much for listening. This is Philomena Jones, and I was addressing the alarm fatigue among nurses. Thank you so much and have a great day.